All right, I want to introduce to you MovementRX, the best remote therapeutic monitoring system on the market for physical therapists. My name is Dr. Andrew Gorecki. I'm the owner of MovementRX. I'm also a private practice outpatient physical therapy clinic owner as well. And today I want to talk to you about how to discover the secret to increasing your profit by 43 to 139% per plan of care and at the same time improving your patient outcomes. All right, so what is remote therapeutic monitoring? Well, we know that physical therapists and physicians universally agree that patients' adherence to their prescribed treatment plans are not the greatest. The outcomes are low. We know that 70% of patients that are in physical therapy do not complete their plan of care in the country right now. Not good, right? So we also know that Americans need accountability. We know that 42% of Americans, when polled, felt like they'd be more adherent to their prescribed treatment plans if they received encouragement and coaching in between visits. So remote therapeutic monitoring was developed to help improve patient adherence to home exercise programs and patient care outside of the clinic. So RTM refers to the use of digital technology to monitor and capture therapeutic health data, such as physical therapy adherence and changes in pain, functional levels, participation in their home exercise program from the patient, and transmits this information to their healthcare provider so they can better manage their patient care needs. We're already doing this. Most physical therapists in an outpatient setting are already creating home exercise programs. We're enhancing that with technology to increase the patient outcomes. And then on the backside, it increases our profit margin, which we know is also declining in the private practice outpatient setting. The average profit margin right now is 4%, and it's declining every year because of declining reimbursement. So this is a nice boost to what you're already doing, and it can help your practice thrive. So the benefits of remote therapeutic monitoring, we get an insight into what the patient's actually participating, what's their therapy adherence. We're enhancing that patient care by supporting them at home. We're providing almost more hospitality. We're providing more of a personalized care, right? We're collecting patient reported outcomes to monitor their success. We're improving their outcomes in both pain and function. And we know that studies are already showing that's happening when implementing this program. And we're going to strengthen the patient-provider relationship, right? We're going to involve them in their care. And ultimately, the goal here, too, is to improve outcomes as well as the financial performance of the clinic so that you can continue to help more people for years to come. So it's really a hybrid support system. So we know we start with the in-clinic PT. They're developing the plan of care, right? That includes then moving on to the home exercise program, which most physical therapists are already doing. We're using technology. We're using videos. We're using customized videos for the patient that you create with them. You're involving them. Then the remote care provider is supplementing that care while the patient's not in the clinic, right? So they are monitoring daily, weekly, and they're communicating with the patient as well as the remote monitor is monitoring adherence and outcomes. It's also relaying that information to the in-clinic PT. So we're making a significant difference there. So what is the MovementRx system? It's a digital home exercise program. It is designed for creating and monitoring the home exercises. And they're all customized, right? They're customized. They're not libraries, 7,000, 10,000 exercises that are cookie cutter. They are custom to the patient. You've involved the patient. You've made the video with the patient. And so it's 100% custom. And then, of course, we have care navigation with remote providers. It is Medicare compliant and FDA approved. So what does it look like? Well, you can see on the left side here, this is an example of what the video looks like. This is the patient actually taking a video of the therapist. And just a little background, I created MovementRx 7 years ago before remote monitoring even existed because I was sick and tired of printing pictures of cookie cutter exercises from a very popular online source. And I started taking videos of patients on their phone. And then I got frustrated because patients would come in a week or two later and they wouldn't be able to find the video because they took a bunch of other pictures and videos. So I created an app that stores and monitors the compliance for the patient. And so you can see that we create a library of customized home exercises in their platform. And then on our end, we can see, are they viewing the video? How many days, how many weeks, how many months have they been viewing it? They also, on the right-hand side, this is the patient's view, when they log into the app, we also have a browser-based version for patients that don't have an app or a phone. They log their pain scale. They can see, we also have access to their health data, so we're looking at their steps, which is great for the patients that have difficulty walking. They also have the ability to chat, so they can chat back and forth with the provider, and so it's a pretty cool platform. So again, it's off-site. It needs to be provided by a PTA or a PT who is licensed in the state the patient lives. We provide those. We have those remote providers. You have your own remote provider when we work with you. And in-clinic PT develops and leads the plan of care, creates the custom home program, and then provides the clinic and treatment. Nothing changes for the in-clinic PT. The remote provider then supports the patient while they're not in the clinic, helping them adhere to their treatment plan, right? And relays any red flag information back to the supervising therapist. It's more of a coaching role, right? It's more of a coaching role. They're not providing treatment. They're not providing answers to medical questions. They are coaching. It's motivational interviewing. It's, hey, you've been doing a great job. I can see that your pain is going down and you've been watching your videos and doing your home exercises. Keep up the great work. Or it's, hey, I noticed that you haven't been participating. What are the barriers? How can I help you, participate more in this program? Because we believe this will really help you. So the goal is to increase that participation, improve the outcomes, and help the patient avoid medications, injections, and surgeries. Now, the supervision requirements. So Medicare specifically created these rules, and the care navigator or the off-site remote provider has to be available directly communication with the supervising therapist. That can be through chatting, texting, phone calls, and it really only needs to be when necessary. So think of red flags being directed to the supervising therapist. Let's talk a little bit about what those codes are. So we have 4 codes that CMS created, CPT codes. The 98975 is the initial setup of the device. In this case, it's an app that goes on a phone or the website. That's a one-time code. 977 is a monthly code, which is essentially they keep the device on their phone. You're billing that on a monthly basis. And then 980 and 981 are both timed codes based on the remote monitoring of the patient's information, chart, all that good stuff. The communication back and forth between the remote provider is also the timed code. All right, so what insurance companies are covering this right now? So we know that Medicare across the whole entire country is covering it, plus Advantage plans. This started in 2022. We also know United Healthcare, Aetna, and Blue Cross Blue Shield, which is awesome. All right, so what's the reimbursement? Now, these are averages. This is Medicare reimbursement actually from Michigan. They're very close dollar amounts around the country. So again, these are averages. That initial setup is $17.70 billed one time only. And again, these billing codes have rules and kind of algorithms that are requirements. So this can't be billed until 30 days following the date the case is added. The 977 is the device monitoring system. That's each 30 days. That's $50.80 each 30 days, as long as 16 days of data collection has occurred, right? So data collection is pain scale, video watching, steps. And then the 980 is monitoring. That is based on 20-minute threshold. That's $40.60 every 20 minutes. That's billed at every end of every calendar month. If at least 20 minutes of monitoring has occurred and one contact, it's required to contact the patient once a month by the remote provider. It cannot happen during a treatment session in the clinic, has to be outside of the clinic time, and that is either a video conference or a phone call. And again, the last code is 981, which is any additional 20-minute increment after the first 20 minutes is billed at $33.30. So again, to review that, the first code is per episode, second and third codes are each 30 days, and the fourth and fifth codes are per calendar month. Our system automatically generates those codes based on the activity of the remote provider. All right, so what are the requirements? We have to have 16 days of data transmission minimum. So there has to be data transmitted before we can bill anything. So if you have a passive discharge in the first 4 days of your physical therapy time, it doesn't work. We have to have data. So participation of video views, steps, or pain scale. It also is important to recognize that the system is communicating data back and forth every single day. And so also no data is data. Has to be an FDA approved device. Our device is FDA approved. Has to be a PTA or a PT license in the state. Length of the home exercise program does not matter. It's all about the time of monitoring. And it has to be outside of the patient care time. And we must communicate with the patient once a month. That communication is either done by a phone call, a video conference. Those count as monitoring times as well. So again, this goes into a little bit of the definition of the codes. 975 is billed per episode of care. And again, this is, when does that begin? Well, the beginning when the remote therapeutic monitoring service is initiated and ends with an attainment of targeted treatment goals. So we know that a lot of patients come into physical therapy and they leave us and they haven't quite met all their goals. You're hoping they're going to. So we continue to monitor for 30 days past their last visit to ensure that they meet their goals. Right, so we take the average plan of care plus 30 days of monitoring. And then again, these codes, the 975, 976, and 977, the device must be a medical device as defined by the FDA. It doesn't need to be approved by the FDA, it just needs to meet the definition by the FDA. And again, you can't report these codes unless there's been 16 days of data transmission. So what does the FDA say that we need as a device? Well, it defines software as a medical device. Right? So the FDA considers software intended to be used for one or more medical purposes that performs these purposes without being part of a hardware medical device, right? And that defines a mobile app, right? Or a web-based platform. That's what we are. And the term software as a medical device, it's software intended to be used for one or more medical purposes that performs these purposes without being a hardware, right? So that fits that requirement. Again, this gives us a little bit more detail on the 975 code. This is documentation requirements. What are they? So this is the in-clinic PT. There's only one. On the first visit, the eval must say this person is going to be participating in remote therapeutic monitoring using MovementRX as the device. That's it. That statement is enough as the only documentation that the therapist in the clinic has to do. Now, the remote provider needs to track everything they're doing. That's a different story. But the in-clinic PT has only one sentence for documentation requirements. We got to document the name and the description of the medical device being used, and document the number of recordings. That's happening automatically in our system. The data is being gathered in our system automatically. But if you were doing it manually, you'd have to make sure that you're gathering that data every time, which is really challenging without some sort of automated system. Okay, so what does monitoring look like? Hold on, did I skip a slide here? I think I'm good. All right, so this is the dashboard of the remote monitor. You can see patients, you can see the active people. You also have the ability to look into their chart. So this is the remote provider's information. You can see completed sessions, pain scale, steps. We always have a log of everything that's happened, who did what, who said what, the chatting back and forth between the remote provider and the patient. You can see the chat. Here's an example of the chatting. You can see an example of what the video looks like from the patient's perspective. And monitoring includes reviewing all things related to the patient, chart notes, messages from the administrative staff, video view steps, daily check-ins, communications between the remote provider and the patient, as well as to the supervising therapist. And with our system, we have a 4-phase implementation approach, right? We start with a kickoff. We want to get a current workflow. What are you doing right now for home exercises? What's your baseline data? How many people are participating? Our goal is a 70% or more participation rate of your patients who qualify for this that are in the system, right? And then we want to identify who is going to be your contacts. Phase 2 of the training is a 1-hour led training. It doesn't take a ton because remember, in clinic, clinicians aren't doing much except for getting used to the app, talking to the patient about, this is what we're going to use. This is how it's going to go. You're going to get a phone call once a month, and then we go live. Phase 3 is go live, and we have training videos for your entire staff. We do weekly group calls. And then our phase 4 is success. So we're going to do a weekly KPI review, making sure that you're maximizing the opportunity. You're meeting your 20-minute, 40-minute thresholds. We recommend 40 minutes a month per patient, minimum. And again, it's a turnkey option. So this is 100% done for you. We have all the remote staff. We have the system. There's no additional clinical time needed. And this is a utilization-based billing, meaning we don't bill you until there's actually been codes produced from our remote monitors and your staff generating the patients in the system. We have a remote provider that's dedicated to your team. And this is actually a typo, a big typo. You keep 50% of the revenue. So we do a 50-50 revenue split. So, we'll look at that in a second. There's no other expenses, right? So utilization-based billing, automated reports of codes that are sent to you each month. Then you enter those into your billing system. All time is tracked and kept and compliant with Medicare and other insurance companies. You only pay for what has been billed, right? So the cost is zero. Let's talk about what that opportunity. Let's talk about what that opportunity looks like. We're going to go to our website here. I've got a little opportunity calculator that we want to use here. All right, so we're going to look at this. We're going to clear this data out. And we're going to look at this top row, or this top section, okay? So what this looks like here is that you can get this on our website, mymovementrx.com. And this is actually real data. Okay, this is my patients last year in my clinic that I own, Superior Physical Therapy. We actually had a 74% participation rate, which means 1,400 people enrolled in MovementRx last year. We generated, this was again based on 40 minutes of monitoring time per patient per month. We generated an extra $333.66 per plan of care. Okay, so the expected annual profit with a done-for-you service, meaning we did it all for you, is $233.56 that you gained, right? Which is pretty powerful stuff. Now, you can see that annual profit is $166.83 per plan of care that you gained from that. Now, if we look down here and we say, okay, if I take the number of visits, right? The average number of visits per case for me is 12. Nationwide, I think it's 13. The average reimbursement for my clinic is $100. Actually, it's I think it's $109. So the estimated profit margin, mine right now we're going to say it's 20%. Okay. So now I just increased my profit margin by 63.77%, right? That takes me from a 20% margin to a 34% margin just by implementing this program right now. So pretty powerful stuff if you ask me. All right, so what are the X factors? What makes this system different than all the other remote monitoring systems that are out there? Well, I can tell you right now, no other system makes custom videos. They're all libraries of cookie cutter, non-functional things that may or may not match with what you are doing with your patient. This is fast and much more efficient than looking through libraries, searching for what you need to find. It is custom. It takes 30 seconds with you and the patient at each visit. And so that's the big differentiator. We're the only company right now, maybe we're not, but we also offer a done for you and a do it yourself option. Let's talk briefly about the do it yourself option. I don't recommend that to start with. I'd recommend starting with 100% done for you, and then if you feel confident in the future, doing it yourself. The do it yourself, we provide the software to be compliant. It generates the billing codes automatically. We train your team, and you keep 80% of the revenue. And it's a utilization-based billing. It's actually comes out to be $15 per patient per month. Right? So very simple to think about that. I would encourage you to visit mymovementrx.com. And if you would like to request a demo, I would love to show you more details about this system. Thanks for listening. Hope you enjoyed it as much as I enjoyed making it.